Hello everyone, welcome to my channel 20th Notebook. I had promised you all to conduct a live session but unfortunately couldn't go ahead because of some issues with Streamlabs. So let's start with the recorded session for today. We will try to conduct it as a daily revision cycle for the next 60 days, so that we'll be completing our whole 20th notebook of 750 pages in under 2 months before your INI. What you will be doing is just flip off the pages, as I will try to tell you the important stuff related to our 20th notebook which I have covered. So beginning with the day 1, for the first 12 pages of anesthesia, the first topic as soon as you open our notebook would be Mapleson circuit. This could be an expected question, but remember three things in Mapleson circuit. One, for spontaneous ventilation, your important mnemonic of all dogs can bark, that is which Mapleson circuit is preferred. Circuit A is preferred in spontaneous ventilations. However, in controlled ventilations, what happens is we have the mnemonic of dogs barking create awareness, where circuit D is preferred. So just remember that controlled dogs will only bark at trained stuff as they sense danger. So what they do, dogs barking create awareness in controlled circuits. Spontaneous dogs that are untrained, they will keep on barking. So all dogs can bark, only trained ones will create awareness. This mnemonic is pretty simple to remember, and you will go through Mapleson circuit easily, especially if it's a sentence based question. Also important thing to remember is that what is the fresh FGF, that is fresh gas flow. It is equal to minute ventilation Mapleson circuit A. That one thing you need to remember. However, in Mapleson circuit D, it will be 1.6 times of minute ventilation. I would not ask you to remember the circuit, the diagram or anything. Just remember in FGF A, in circuit A, FGF is away from the patient. Okay, A means away. Just remember these things in Mapleson circuit. What would you go ahead in closed circuit? I would prefer you don't remember much. I don't expect them to ask a question on closed circuits. You can have those absorbents, just try to read them once, but I don't think they will ask a question on closed circuits this time. Same goes ahead with pin index system. I don't expect them to ask you a question on pin index system. Next thing is Boyle's machine. You obviously can't remember everything in Boyle's machine, and it is not needed also, except for one thing. Just remember what is the component of intermediate pressure system. Intermediate is when your high pressure system has failed. So what are the important things that come under that? Failsafe valve, oxygen failure alarm. I expect if they at all ask a question on Boyle's machine, it has to be intermediate pressure. Among these two, then there is one more important thing, that is second stage pressure regulator, which by itself means that second stage, that is intermediate. So if they at all ask a part or component of Boyle's machine, it has to be between these two. Moving ahead, we have next important thing, that is vaporizer. I have given you the most important mnemonic of RP Boy heights. I don't expect them to ask a question anyways, but still just remember that mnemonic. Next is the most important thing in anesthesia, which is oxygen delivery device and airway devices. In oxygen delivery device, you just need to remember the classification of high flow and low flow. Low flow will be basically variable flow. Remember the most important thing that they might ask in this will be Venturi mass and NRBM among all the airway devices. I don't expect them to ask a question on anything else. Just remember Venturi mass is based on Venturi effect and has variable FiO2 depending on the color coding. Other than that, NRBM is a non-rebreathing mask, so you just need to remember that. And there is one formula which we have given for calculation of FiO2. Remember that small formula they might ask for calculation, because it has been previously asked in FMGE, I guess. And other than that, you have your airway devices. What thing can be expected in airway devices is ambu, giddles, and nasopharyngeal airway. So among these, ambu is the most important, and they had asked two important things: the full form, which is artificial manual rebreathing device, and when does the pop-off valve goes off? It goes off at 60 centimeter HU. This is to prevent excessive ventilation, as we know that sometimes we tend to give high pressures when we try to compress the reservoir bag of ambu. So other than that, there is your supraglottic airways, where they have been classically asking questions from first generation LMA or second generation LMA. In especially second generation being more favorite for the examiners. Procil and IGEL are the ones which I would expect you guys to remember the diagram of. And in first generation, just remember fast track and classic. Next, going ahead, we have ET tube and its calculation for adult males and all. There has been an error in this section for the formulas. You need to change that. It has been uploaded as errata PDF also. Next, there are others important stuff in ET tube, like the diagram you need to remember, and you need to remember those flexometallic, south facing, north facing, which I doubt will be asked. Next important thing that you need to remember in airway devices, the laryngoscopes, the names which are used in children and which are used in adults, McIntosh in adults and Miller in children. Other than that, the position which is most important is the morning sniffing position, where there is extension at atlanto-occipital joint. Okay, other than that, I expect them to ask a question on monitoring and reversal agents. Airway assessment has been a cliche question, has been asked many a times. So you just remember the Mallampati reading, don't remember the rest of the stuff. I don't expect them to ask for this exam. So remember the Mallampati reading again, which is a classical question, but it's quite cliche because it has been repeated many times. In monitoring, what can be asked is, you have to remember two important things in monitoring. The most important being capnography, the pressure range between 35 to 45 mmHg. Why is it so important? Because it is the first clue to development of a fatal condition, malignant hyperthermia. What happens in malignant hyperthermia is there is sudden rise in EtCO2, which is reflected in your capnogram. Other important things you need to remember in capnography is your curatic lift. There are other important graphs like sudden drop due to venous air embolism or flat capnography and all, but this can be rarely asked. The important things which you need to remember are curatic lift and malignant hyperthermia. And there are other stuffs like depth of anesthesia, blood pressure, central venous pressure, pulmonary artery catheterization, pulse oximetry, which can be skipped effectively. One more important thing that they might ask again is neuromuscular monitoring. Which muscles and which nerve is most commonly used? Ulnar nerve and adductor pollicis muscle. And you just need to remember this important diagram where they will give a machine with the recording stuff attached to your thumb for the movement of probably adductor pollicis, and along the ulnar aspect of arm there will be two electrodes placed for the recording of ulnar nerve. It will be somewhere like this, eye image where there will be two electrodes on the ulnar aspect, and then there is one more electrode connected to a device like this. Just remember this stuff. Other than that, what else can be asked is this thing which I have not included in my notes for the difficult intubation guidelines. Just remember, anyone will usually start with laryngoscopy first. If it is failed, only then it will go to supraglottic airway device. Laryngoscopy is basically helping you to intubate the patient. Supraglottic airway device, if it is succeeding, then again you can you need to remember that the other important options available in supraglottic airways, the option of tracheostomy, and if even supraglottic airway device is failed, then you need to remember that you have to go with face mask ventilation. And then that also fails, then you have no other choice left but to do cricothyroidotomy. And then we have other important stuff of risk stratification, the ASA grading. I would not talk much about risk stratification as of now. Then you have I don't expect it to be asked, so you can strike that off. Next is pre-existing drug therapy. What can be asked in pre-existing drug therapy is the most important thing. ACE inhibitors. Majority of the hypertensives will be on ARBs and ACE inhibitors. Just remember, ACE inhibitors you need to definitely stop 24 hours prior. Some reports suggest ARBs also to be stopped, but some because both of them essentially have the same action except for downstream and upstream target. Just remember, ACE inhibitors has to be stopped 24 hours before. Other than that, you can remember about aspirin and heparin and other anticoagulants. Rest of them like MAO inhibitors, hormone replacement therapies, OP pills and stuff, I doubt they will be asked. The most important thing is the antihypertensives and anticoagulants, which can be asked in pre-existing drug therapy. So other than that, I expect one question from pre-anesthetic drugs also. So you all know what pre-anesthetic drugs are used, basically for anxiolysis, then for allergy, then to prevent preoperative nausea and vomiting, and for providing analgesia and to prevent body or secretion. So these are the important stuffs which you need to remember. Just remember the anxiolytic ones, the antiemetic, analgesic. That's all. So rest of them can be skipped, and the most important is to prevent secretion glycopyrrolate. Okay. And among these, when do you stop the drug? Just remember that among all the anticoagulants you or blood thinners, as of all hemolytic drugs, just need to remember both dabigatran and warfarin are stopped 5 days before, and all your direct NA inhibitors are stopped 3 days before. LMWH and heparin are continued for quite a long time, just stopped 12 hours before surgery, and aspirin can be continued. That's all from that section. Next important section is your complications of GA, which can be expected. The most important and author's favorite is rapid sequence intubation. The steps: what pre-oxygenation for how long, 3 minutes or 5 vital capacity breaths, pre-medication with what drug, metoclopramide and ranitidine, and the most important thing, that is cricoid pressure or Sellick's maneuver. Remember, your bag and mask is contraindicated. The rest of other complications are also important, like postdural puncture, headache, TDPH, and what else can be asked is your malignant hyperthermia. So remember these things, and also remember that important aspect where when can you predict the return of neuromuscular blockade with all your train of 4 values and all. So that can be asked. Other than that, complications, just go through them quickly once. Other than that, I've given you the Aldrich, the author's picks questions, Aldrich scores, extubation criteria, bias block, TIVA and SCH. However, bias had already been asked in previous exam and I expect it to be repeated again. TIVA and succinyl colon are all classic questions which can be asked again. So just quickly before ending today's section for the first 12 pages, I just want you to see these MCQs. Don't panic when such MCQs come and always be ready to answer such questions. You will always have gone through these MCQs somewhere or the in other format. Just remember, which of the following is associated with lower incident of post-operative nausea and vomiting. So this kind of looks like a tricky question and most people would tend to skip it. But I just want you to answer this in comment box and just think through what can be associated with lower incidence of nausea and vomiting. Then there is one this question where there is a kind of a small amount of thinking required, but also remember when they are asking for so there is a 75-year-old with hypertension who is said to undergo laparotomy surgery for carcinoma colon, probably for colectomy. So continuing with which antihypertensive preoperatively in geriatric age group is found to be associated with profound hypotension on induction of general anesthesia. So you all would have got this answer right, but remember this is a long question just to waste your time. You already know the answer. What can they ask for pre anesthetic drug monitoring and which drugs to be stopped? So just remember that they want you to give a clinical scenario so that they make it difficult, but you already know the answer. You can comment that in type comment box. Next is this question where they don't want to directly give you the clue of color coding of cannula. So they will give you some twisted question where a patient of RTA is presenting to AR with profound hypovolemia. What cannula is preferred? So they are giving you the clue that there is profound hypovolemia. So what do they want you to do? They want you to instill large amount of drugs. NS or any fluids to be administered at a faster rate. So what would essentially be your this thing trick to get into that? So you will need a larger bore so that you can instill larger amount of fluid. So if there is a larger bore cannula, you need to find out among the option which of them is the larger bore. So it is an indirect clue to your gauge based color coding. Next is they can ask question like this, another clinical scenario where most of them would get it wrong. So choose wisely if you can understand the logic behind the question they are asking. Just check that a patient is with uterine fibroid who is suffering from already moderate to severe cardiac ailment. Which of the following should be avoided? So a person can have two school of thoughts that so uterine fibroid is done under different kind of positions, surgical positions. So people might think, okay, a patient is having cardiac ailment, and if the surgery is done in a reverse Trendelenburg position, then it will be definitely detrimental to the cardiac function. So what kind of surgery might be done under reverse Trendelenburg position? So you will think in that way, and you might think, oh, vaginal hysterectomy might be the answer because you might need a proper clearer vision. But no, this is not the thing which they wanted you to remember. They wanted you to remember that in lap hysterectomy they will insufflation of CO2 is done to create a surgical plane. So CO2 is already a cardiac depressant. So they want you to trick by thinking in terms of surgical positions. So just remember, if you are in the right path, only then answer such tricky questions, or else you can skip such questions. There will be hardly 10 of them. Okay, then there is the most important classical things which they might ask, which is IBQs. They can ask IBQs directly, like color coded nasal cannula, or in a clinical format that I had given there. So they want you to identify what needle is this among all the options. I hope you would have figured this out and you would comment this in the comment box too. Thank you for attending today's session. I try to complete it as much as possible, but I, however, could not stick to the timings. Hope it was enjoyable to all of you. Just remember that you have flipped through 12 pages in 20-25 minutes and you are confident now with those 12 pages. Remember doing this for 60 days regularly, just giving me 15 minutes instead of watching a short reel or anything on Insta. You will be definitely answering 150 plus questions. Okay, just remember this. I'll also try to discuss some PYQs which have been or have not been covered at the end of a particular subject. Just try to stick to the schedule, whatever you are following, and also give me 20 minutes extra. Thank you for attending today's session. Comment the answers for the MCQs in the comment section below.